October 2017, the dramatic results, 58% complete response rates observed in the ZUMA-1 study supported the FDA indication of approval of relapse refractory large cell lymphoma patients to be treated with the axi-cel therapy. This really became a therapy available to patients across the nation in January of 2018. We worked as a collaborative group with 17 centers. My colleagues Safa Nilapu and Fred Locke from the Moffitt Cancer Center and myself organized this real-world consortium, and the results of the first 275 patients treated at these 17 centers were tabulated and followed for a year's worth of time. This has been published. Loretta Nostapil is the first author, JCO article, and colleagues of ours from some of the other cancer centers have a smaller but equally interesting real-world experience. So these real-world experiences were critical in the early stages in the treatments of large cell lymphoma because they validated the observations that were seen in the clinical trials. And remember that the clinical trials look for the perfect patient, the patient that has wonderful kidney function, has no complications from their years of therapies, and have none of the real-world problems. But our studies had 42% of the patients that would not have been eligible for participation in the ZUMA-1 study due to most frequently low platelets, blood clots, renal insufficiency. And so what did we see? We saw the same successful complete response and durability response. The complete response rate was 60% in that patient population. And we showed two stratifications because we had 275 patients that were able to predict the patients that would do better. That was low LDH or less than, so a normal LDH going into lymphodepletion chemo, and a performance status of ECOG 1 or 0. That is a pretty well-functioning individual going into the therapy. Those two factors alone predicted for marked improvements in, again, response rates and durability response. Our program, our group, our team is putting together the 3-year follow-up for this study, and we'll be submitting this as an ASH abstract for presentation December 2021, which will give us the durability in the real world, which is another real question. We expect that the CIBMTR, for which all of our programs participate, will continue to hold the mantle for long-term follow-up of the patients going forward. But these short-term real-world experiences over the last 3 years were really able to give those rapid turnaround and I would say confidence-building opportunities to see that patients really had the same benefits in the commercial therapy as we saw in the clinical trials.